All right. We're going to go ahead and get started. Thank you all for being here in attendance. We are going to be talking today about the new HMIS-based by name list, sort of the HMIS processes involved there, and the slotting process, the new one. It's not necessarily new, but we're using the new HMIS-based by name list to guide those decisions. And so we want to make sure that you all have a very comprehensive overview from beginning to end of what this looks like. So I'm Nick Bettina. If you don't know me, I'm one of the administrators at the Office of Homeless Services. Co-presenting with me is Amanda Larson. Go ahead, Amanda.
Hi, everyone. I'm Amanda Larson. I'm the OHS HMIS System Administrator. Thank you all for being here today.
Thank you. And so a real quick overview about some housekeeping stuff. We are recording this webinar. It's going to be on our website, hopefully within a couple of days. I'm trying to get a little bit fancy with it. I'm going to try to get some, some YouTube stoppers, right, where you can see where certain sections start and end. Never done that before, so give me some time to work all that out. Um, you all have been sort of permanently muted and your cameras have been turned off for the webinar portion. Um, but of course, we encourage your questions. And so to do that, at the top of your screen, you should see something that says Q&A. You can put your question in there at any point in time when you have a question. Um, and one of us will respond to that question. At the end, we are also going to have a live Q&A session, which we can allow your mic to work. You can come off mute, you can ask your questions, and we can actually discuss it that way. So you have two ways. You got your Q&A and you have the live Q&A at the end. So don't feel like you have to sit there quietly. We want to hear from you. We just thought for the purpose of the recording, not to have everybody have ability to unmute for the sake of noise. Um, Anything that we share in this webinar should absolutely be disseminated to anybody that you feel like it's necessary to share with. Definitely have HMIS end users watch this webinar if they are not in attendance today. We only have about 60 people here, so there's definitely more people who need this. And so we want you to make sure to give that out. And again, it'll be on our website, and we will put that website link in the chat here in a minute. I have a chat function. I'm not sure if you're seeing it, but please put your questions in the Q&A because if they're not in the Q&A later, I won't be able to sort of print those out or present those to anybody. The Q&A function is good because it creates a sort of an FAQ from the webinar. Here's our agenda. It's a big one, but we're going to hope to get done within the hour, hopefully an hour, and then have some time to chat at the end. I won't go over this the entire agenda now, but you can see that we're going to go from beginning to end, starting with sort of a really basic overview of what a by name list is and why we do it, all the way through to running the report in HMIS. So from there and everything in between. All right. So we'll go ahead and jump into the by name list overview. Sort of what is a by name list? Why do we use it? So the by name list is a comprehensive real-time list of names of people who are in our community. We use this list to track and manage sort of the entire population rather than and individually be able to see everybody rather than what normally comes out of HMIS, which is aggregate data, aggregate numbers, right? Now we are able to see details on each individual who's experiencing homelessness, down to their housing needs, what their health status is, homeless history, which is really important, as many of you probably already know. But it helps us to target our interventions towards people using their actual information. Um, we want to sort of monitor our progress towards ending homelessness, right? Which is the entire goal of all of our work. And this is just another tool in our tool belt to help us do that. Um, so we'll move on here. So I'm going to turn it over to Amanda, who's going to talk about how we activate people on the list.
All right. Thanks for starting us off, Nick. So yeah, who do we what participants do we need to activate on the list? That's any homeless individuals or heads of households that are being served by a program or housing provider that has a housing plan either using COC funding or other funding. There are certain subpopulations that should be activated on the list, regardless if they have an established housing plan or not. That's unsheltered persons and their families, homeless vets and their families, homeless young adults and young adult led families, homeless families, and then chronically homeless families and persons. Of course, this can be done verbal or written consent, and that is all tracked in HMIS. Now, of course, consent is required to activate individuals on the by name list. As I said, that could be written or verbal, and that is, like I said in the previous slide, tracked in HMIS. However, if consent is refused, we have opened up the option to anonymize a record. So by creating this functionality, it's preventing people from being missed or skipped over for housing opportunities just because they didn't necessarily want their information in HMIS. However, with that being said, we've also updated our policies and procedures so that no agency should have more than 1% of its total participants served at any given time anonymous in clarity. Um, the anonymized records in HMIS do not contain any identifiable information. Participants are given a unique identifier, which relates to the record that is in HMIS. Then at that point, all pertinent by name list information can be added to the by name list assessment for these anonymized records. However, it is the agency that is adding the anonymized record to be responsible for keeping track of who that record in HMIS belongs to. And if they are ultimately slotted for resource, we would need to know what unique identifier goes with what record. Okay.
All right. Thank you, Amanda. Um, so really what we want to drill down on in this webinar is sort of who's responsible for what. I think that's caused a little bit of confusion as we've moved through this new process. And so we're going to sort of identify at each point, each sort of step here, who's supposed to be doing what. And so when it comes to activating people, you right now everyone's going through coordinated entry, right? They're calling the number, a number to get to somebody at coordinated intake. So those people who are acting as this what's called the CE access point, they can activate those people and should if they are identified as one of those special subpopulations and they're not diverted. So if people are calling coordinated intake and they are diverted, they have another option. They're able to go somewhere else. They are not going immediately into shelter. Then they shouldn't be put on the by name list because they're not technically homeless quite yet. Again, as we said before, people who are homeless are the only ones who should be on the list. Should only be on the list if you have a housing plan, unless you're one of those special subpopulations. If you're a provider agency, you also have the responsibility of activating people if they aren't already activated through coordinated intake, right? Sometimes people go into shelter first and call coordinated intake after. Um, it is your responsibility as one of those provider agencies to activate people just as coordinated intake would. Um, so you have the people who are in the special subpopulations, but you also have people who get through what we're considering the housing assessment portion of the CE intake. So as many of you know, we're going through a CE redesign process. The intake itself right now is pretty lengthy, right? In its entirety, we're hoping to split that into two, sort of having the initial intake happen at the front door or the first call or whatever you want to call it. And then those who are eventually identified as needing housing through COC resources to get sort of the housing assessment portion. And it's at that point that we would activate people that are not in a special subpopulation. Um, and then so there's also a role for people who are not in HMIS, right? There's a lot of people who are being served by folks who are not in HMIS either because of a federal rule or because they're just not, funded to do so, and that's okay. But sometimes they still need our COC housing resources. And so the idea here is that if you are one of those non-HMIS participating providers, there is an avenue here for you to get people on the list as well. And basically that's sending the information to coordinated entry. So all you would do is email coordinated entry, tell them, hey, we have this person here. They are in need of housing. Here's their information. And as we go through all the different steps here, all the different steps in sort of the by name list process, that stuff can be done on paper and turned in via email to coordinated entry to activate somebody and get their stuff filled out. All right. So question is, how do we do it in HMIS, right? So for those of you who are in HMIS, we want to show you that. Now, we've created slides to show you or sort of outline those steps. We're going to show you in real time. Now, we're not going to read through these for you. So basically, the question is, how do we get somebody on the list? How are we activating somebody? And we made this as simple as possible. If all we would do here is search our person, whoever we're looking for. In our case, we're doing Happy Halloween. Okay. This person already has a record, and you can see down here at the bottom of the profile screen, there's 3 questions to answer. The by name list status question. All right, so you have 5 options. I'm sorry. The first one is active unsheltered, somebody who's not using a shelter or transitional housing resource, somebody who's active and sheltered or in transitional housing. And then you have 3 inactive statuses to choose from. The first one is unknown missing. We don't know where they went. Permanently housed, they've have a resource, or non-permanently housed. And we'll get into the inactive statuses in a minute, or more than a minute, but it'll be some time. We'll have some time dedicated to it. So we're gonna choose that this person's in shelter. It's gonna ask us, okay, are they a part of any of those special subpopulations that Amanda talked about earlier? And you would select as many as apply. Okay. Um, we'll get into chronic status in a minute and how we do that. But if you think someone's chronic, you can go ahead and do that. And then the by name list status change date. So this is sort of when you're updating this status, right? You can backdate this to whenever you feel like you need to, but really the sort of standard is whenever you change that status, just put that date there, and then you would save changes. Okay. We also talked about, if I go back to search, we also talked about anonymizing a record. And so to do that here, this would be a new record, right? If somebody has a record already in HMIS and they already have a signed HMIS release, we're not going to go in and anonymize that record. That would totally blank out all the information that is present for them already. And so just because they refused maybe your HMIS consent for your agency, if they've signed it in another agency, it covers you because our release covers 3 years of HMIS data entry for the entirety of the continuum. It's not just based on each agency's consent. Okay. So if you have somebody who did not consent and they don't have a record already, when you go to add the person over here, you would choose this consent refuse option, and you can see it immediately blanks out all of the identifying information. When it comes to some of this stuff down here, you can put this in if you know it, right? At that point, you're not getting any of their identifying information, so having some demographics about them is still okay. And you could see here that by name list status and the change date are here. So you're able to activate them right here, right now. Again, what will happen is um, in that record, if I go back to Happy Halloween real quick, that unique identifier that's listed here will be their unique identifier. And so what we're asking you to do is to track that unique identifier outside of the system with that person's name and maybe their pertinent identifiable information, and then be able to say who that person is when we have meetings and they come up on the list, right? So we might say, oh, we see this anonymized person here. They're ready to get slotted for whatever housing opportunity. You have to be able to tell us who that is, and give us updates on that person. All right. So we will move on to the by name list assessment, which is the primary way that we're capturing information about people on the by name list.
So as Nick said, this is where all the data that gets pulled into the by name list comes from the by name list assessment. A full by name list assessment doesn't necessarily need to be completed all at the time of intake. We understand that once you get your participants in your program, first you should activate them immediately, but then as you're getting to know them and working with them, you could go in intermittently and enter in the data for the by name list assessment. However, again, with that being said, complete information on the by name list assessment is essential for the slotting and prioritization process. So if a participant has an incomplete assessment, it hinders the ability to slot that participant based on resources effectively. Some data elements already populate in the by name list when you start one because they cascade over from previous assessments that may have been completed for that participant for different program enrollments. We just want to highlight here that it's important to review that information that's getting cascaded over to make sure that it is accurate, as well as any updates that you guys are entering in the by name list assessment. So I know I stated that when you start one, it cascades over, but also making sure that we're taking note if one is already entered in an HMIS and updating the ones that have already been created. We'll talk a little bit more in the webinar about when you should enter a new by name list assessment, but it's ultimately for each period of homelessness, you should have one by name list assessment. So who ultimately is responsible for filling out a by name list assessment? The primary providing agency working with that participant is responsible for compiling and updating the information that goes into the by name list assessment. For HMIS participating agencies, they can just go into HMIS to do so. We'll show you in a little bit what that will look like of how to create an assessment. However, for non-HMIS participating agencies, that's where you must complete a hard copy of the assessment and send that over to CE, who will then ultimately upload or enter that data into the assessment in HMIS. Now, again, with that being said, this is a collaborative effort. So ultimately, it is the responsibility of all the providers working with that participant to update and complete the by name list assessments as you're receiving the information. And so we'll actually move into showing you what that looks like in HMIS. Again, we have the slide here highlighted for your reference to go back in, but we'll show you in real time what that will look like.
Thanks, Amanda. So once you're in somebody's record, you automatically come to the profile screen and you'll find that by name list assessment up here in the top under assessments. You have a list of a few here. The top one, at least right now, is the by name list assessment. So you'll go ahead and start it. Now, as Amanda had mentioned, if somebody is still homeless and I see that they have already a by name list assessment, I can go in and update that assessment rather than creating a new one. We only create new ones when they have been inactivated and come back onto the list. And again, we'll talk about that in a little bit. But for the sake of what we're doing right now, I'll just start a new one to show you. You go ahead and hit start on the by name list assessment row. And again, as Amanda mentioned, data does cascade over from many different assessments, many different places. So if somebody already has an enrollment, like let's say they went through coordinated intake, and then you're going to start the by name list assessment at the shelter, some of that coordinated intake information will cascade over. We don't want to be changing that or updating it unless we're absolutely sure that we have different information than what CE captured. So I'm going to go through this line by line so I can really give you an explanation of what each of these data elements actually means. Ooh, excuse me. And sort of how we've operationally defined them. So at the top is the assessment date. This is the date that the assessment was completed in HMIS. So it should be the date that you are physically filling it out. There are a few things in here that aren't listed because they're sort of they come from somewhere else in the record, but they apply to the by name list assessment, and that's age and veteran status. So that's coming from the profile screen based on the date of birth and what veteran status you choose. but just know that those are sort of behind the scenes data elements that are captured on this assessment as well. The date identified is the date of initial contact when that person experiencing homelessness in any program or at any other point of a homeless system entry. That's the date we're going to put there. So you can see for the purposes of this person, we completed this on 210, but maybe we said, oh, we identified their homelessness started on 9/1/24. Okay. So you can backdate that as far as you'd like, but really we're looking for like this current episode of homelessness and when they started to experience that episode of homelessness. The next is verified chronic. And when we talk about, we'll talk about this in more detail in a minute, but you have basically the idea is, do we have documentation that verifies their chronicity? Are we presuming that they're chronic, meaning that I think they're chronic? I haven't yet uploaded that information, but I will, right? And so I would choose presumed chronic. And then there's people who we know are not chronic, right? So the rule of thumb here is that we put everyone as presumed chronic if we think or have a really good inkling that they are chronic. If we know they are not, this is their first episode, they just started to be homeless maybe a week ago. I know they're not going to be chronic, so I'm going to choose chronicity not verified or non-chronic. The only entity, and that's what this little this warning is here. The only entity that should be changing to verified chronic is coordinated entry. They're the ones who are going to verify the chronicity based on the documentation you upload, and so make sure that we're not choosing that as a provider. Okay. And this number of homeless days from the past 3 years not captured by HMIS program enrollments, so that's non-HMIS homeless days, is going to come from the documentation that you upload. So coordinated entry will be adding those days in if they approve your homeless verification form. Again, something we'll talk about in a minute. Disabling conditions. Um, this is very similar to any of you who have done enrollments into your program. This is the same questions from that screen. Does somebody have a disabling condition? Yes or no? In this case, somebody put no, which is fine, but there's yeses underneath it. And so it's giving us warnings that doesn't make sense because you said they don't have a disabling condition. So how can they have a type? So we're going to change that and update it to yes, and those warnings will go away. So once we choose yes, though, like I said, you have to make sure that something is yes underneath it. And so physical disability, we're looking at um, things like loss of a limb, loss of vision, loss of sight, broken bones, things like that. And then talking about long-term status. Is it something that's long-term? Is a broken bone long-term? No, but currently maybe they have a broken bone, right? And so we can track that. Um, and so developmental disability then, do they have some type of learning disability, Down syndrome, ADHD, Tourette syndrome, things like that would fall into the developmental disability. Um, these are HUD definitions, by the way. Chronic health conditions, yes or no. HIV/AIDS, yes or no. Mental health, and substance use disorder. And so you have the ability to choose whichever is appropriate. One thing that we have already run into is that we see a lot of people who are trying to verify chronicity, but they don't have any listed disability in the system. That's going to cause us to sort of question that. And so you want to make sure the disabilities are in there. Then you get into earned income and sources. So do they have income? Yes or no? If the answer is no, got nothing else to do there. If it's yes, you'll have your options and you'll have to select which of them they have and then give us the amount. And it'll automatically total their monthly income. So this is all monthly income. We don't want annual numbers. We know that folks' income changes a lot, especially if they're doing like seasonal work, things like that. And so that's why we use monthly income um, for each individual or family. The next questions are have to do with a lot of these other sort of program eligibility and prioritization factors. So housing plan, what is their housing plan? You have a lot of options here. We're seeing a lot of PSH building. If somebody's appropriate for a scattered site instead of a building, maybe they want to be out in the community. They have less of a vulnerability score or something like that, that they're more appropriate for living out in the community than maybe in a very highly supported PSH building. We have the joint component, which is new for YHDP. There's also a self-resolve. Maybe people don't want any of those resources, but we are still going to work with them on finding their own fair market rent somewhere. Um, or maybe they don't have one, right? So there's a lot of options here. Basically, this is going to help us determine which track, this really, I say us, it's coordinated entry, determine which track to put them on and where to slot them should those resources come available. Is someone CMHA eligible? You know, are it's based on their history with CMHA, right? If they have had CMHA before, maybe they owe them money, and so they can't get CMHA right now, we would select no. Otherwise, it's yes, right? We want to be able to hook them up with the CMHA voucher if possible. Is there past DCFS involvement or are they involved currently? Yes or no. Sexual orientation, we'll choose whichever is applicable. Survivor of domestic violence, yes or no. Okay. Prior justice involvement. We have three options here. No prior justice involvement, which is fine. Prior justice involvement that is likely to be a barrier to housing. So those things are like meth production, arson, sex offender status, and then other relevant justice information. If you choose other, we're going to ask that you type in what it is. Sometimes those things do get in the way of housing, and we just have to be able to plan around that. If you do choose one of the something that is likely to be a barrier to housing, it would be helpful in the notes section for you to tell us exactly which that is. So, because some things like sex offender status could put you in a specific PSH building if that's the housing plan. So we want to make sure we know exactly which one is the barrier. Then we have prior evictions. Do they have any? Yes or no? Pretty simple. Were they formerly a ward of child welfare or foster care agency? That's HUD language. But the answer is either yes or no. Again, this helps us determine eligibility for certain types of vouchers. Did they age out of foster care? Yes or no? And then the assigned staff. Basically, we want you to put your name here if you're the person filling it out. So in this case, I would put my name. And then I would know, or coordinated entry would know that you're the person to reach out to because you're the primary, right? And you'll help get that information about their housing opportunities to them. This note section looks small, but it's super important, okay? We don't need a bunch of case notes, right? Like what you're doing with them every time you meet with them. But what we would like to see here are updates on their housing progress. And why we would like to see that is not only to know where they're at in that process, but it also helps reset the clock. Uh, we'll get into how we inactivate people in a minute, but this note section is going to help us reset the clock on the 90-day time frame that people can stay on the list without any movement, right? So as we update these notes, it sets it back to 0 days since last update, and then they can stay on the list and hold their spot on the list as long as they need to. Okay. We just ask that you might date those notes as well. So just start by putting a date in, 210, and we can say changed housing plan to PSH, something like that. Um, Also, the note section is not the only thing that does that. If I come in here and I do update that housing plan to something different and then I save it, that does also reset the clock. So as long as there's updates being made somewhere on this by nameless assessment, you can reset that clock. This last thing at the bottom is something I can't get rid of, unfortunately. But we ask that you do not touch it and that it remains off. It's private. And what that would do is if I were to turn this on, only me and the people within my agency can update or see this assessment. And that's not helpful because as we said, this is supposed to be a sort of collaborative effort between everybody to get this information in. And so if you make it private, you're limiting how much collaboration we can do. So make sure we're not doing that. And so we would save this by name list assessment, and the information is now good to go and will pull on the list. And we will go back to the presentation now and get into how. Oh, so I said we're going to spend some time talking about this. The verification of chronic homelessness. I said a lot of it already, but I think it's worth repeating. Um, Here is just the definition of chronic homelessness. This is the HUD definition. It's really lengthy, it's very wordy. Okay, but what we pay attention to, most of our folks fall into sort of this first category here, or this first, I shouldn't use the word category, this first um, definition of chronic homelessness, and then these other two also apply. But basically, it's somebody who is currently homeless, literally homeless. They're living in a place not meant for habitation. They're in a safe haven, they're in a shelter, maybe transitional housing if that applies, and they've been homeless for at least 12 months. Or at least four separate occasions in the past 3 years, as long as it equals more than 12 months, or at least 12 months. And it sort of outlines what an episode counts as, and there's a break of 7 days or something like that, right? So there's a lot of language that helps determine who's chronic. We also have a portion of chronic folks who maybe go into an institutional care facility, whether that's a substance use treatment facility, a hospital, or some sort of facility of that nature. And they were there for fewer than 90 days and they had met the criteria over here, right? The 12 months for, or four or more episodes for 12 months prior to entering. And of course, a family would be considered chronic if the adult head of household meets the chronic definition as well. Okay, so I think a lot of us are familiar with this. I just wanted to put this in here to sort of outline what I'm talking about. But how do we verify chronicity? Okay, so this is the process as it stands, and it seems to be working for the most part. Um, as I mentioned when we were going through the by nameless assessment, everybody who you think is chronic, you just have to provide documentation on. We're going to put presumed chronic, and then we're going to complete this homeless verification form. This homeless verification form is for non-HMIS bed days only. Okay? The HMIS bed days will come from HMIS. We have a column on the by name list that totals up the number of days somebody's been enrolled in the project. But there's a lot of people who meet chronicity because they have a lot of unsheltered time or non-HMIS bed days, sheltered days, right? And so we want to be able to account for those things, and we're going to do that with this homeless verification form. So let's look at this form. It is here. It will be available on our website. I realize it's not there yet. Just oversight by me, but we are going to get that on there shortly. Um, Basically, you're going to put the person's name, their date of birth, and then what agency, what your name is as the case manager filling it out, and what agency you work for. Does your agency have access to HMIS? Yes or no. You could put, if you are an HMIS participating agency, you could put yes. I think actually I removed this. We don't need you to attach an HMIS printout to this at all. So I'm sorry, please ignore that. But if you have access, we just want to know you have access so you're checking what you put down here against HMIS so there's no overlaps. You'll want to look up the date or know what the date of their last coordinated intake was. Um, we need to know if they need an assessment from coordinated intake, yes or no. And then we're going to come down here and we're going to be very specific about those sort of, I will call them episodes, right? Or those times that they've been homeless outside of HMIS. So we've been seeing recently a lot of people fill these out and they're being very vague. They're saying street corner, and they'll give us like an intersection, or they'll just say, "Oh, an abandoned building." So we have to be as specific as possible here, okay? Because this documentation will eventually get into a PSH application, and it's really, really strict in terms of what qualifies as self-report, what qualifies as third-party verification. Um, so we want to be sure to be as specific here as possible so that we can use that information when it comes time to do the PSH application. So you'll fill out as many of those as you can. Again, double checking it with HMIS to make sure that what you're putting in here doesn't overlap with HMIS bed days, right? Because if we're counting days twice, we're duplicating the count, it inflates the count. All of a sudden, somebody might get higher on the list because we've inflated that count. So you want to make sure it's as specific as possible, and it will get kicked back to you by coordinated entry if there's overlaps with HMIS. So you'll add up all the days, total them down here. There is a link here to help you calculate the days, so you don't have to worry too much about, getting it right with just your math. You can use this to help you determine it. Oops, excuse me. And then you have applicant is chronically homeless. So you would choose which definition they fall into, consecutive 365 or 4 episodes for that total of 365. Or they're not chronically homeless, which at that point is okay. We're just documenting days outside of HMIS. You'll sign it, date it, and then we're gonna upload this into HMIS, and then you're gonna email Nikki Eggert, Danette, and Nikki Eggert, Danette Nagel, and Margaret Cooney at Frontline, all sort of functioning as coordinated entry, and they'll verify this for you. Okay, so once you upload this form in HMIS, you're going to notify CE. Then CE is going to review it and approve it, or they're going to kick it back to you, and then you'll have to make some edits or changes to it. And then they will go in and they will change, once it's verified, they will change their chronic status to verified chronic, and then add the number of days into that section of the by nameless assessment. Okay, then if you are non-HMIS provider, you will complete that form the same way and send it to CE via email, and they will handle the rest from there. Okay. At that point, if you're a non-HMIS provider, you don't know overlaps, right? You don't know overlaps with HMIS, so you can include those bed days if you'd like, or you might get it kicked back because it doesn't match what HMIS says, and so CE will work with you on that. And then what CE does, okay, once they verify it or once they note what's wrong with it, they do add that into the note section of the by nameless assessment so you can always see it. Um, there's going to be communication still, but you'll know that it's there. You'll know why without having to wait for them to respond back to you right away. Okay. So just real quick, again, noting where that's at on the by nameless assessment here. So everyone we presumed chronic. Okay. And then you would upload documentation. CE would review, they would come in, change it to verified, and add the number of days that you put on that form. We're going to probably show you this a couple of times, but to upload that form, you're going to come up here to Files. And then under Client Files, you'll see some things are already in here. You got a housing offer form, we got a PSH application, but we would add a file and we would choose the correct category, which in this case is housing documentation, and choose the predefined name, which is the homeless verification letter. We would select the file, and what that does is brings up, your folders, right? All of your document folders. You would choose the right document, hit open or double click it, whatever you choose, and then hit add record. Again, not something I can remove, but private is here already, or it will be here. So you need to make sure you don't check that off because then CE will not be able to access it. Okay. Okay, back to the presentation. We're going to get into the vulnerability index, which is the next sort of piece to the puzzle of the by name list.
Okay, thanks, Nick. So the vulnerability index is one of the main determinants of who is getting selected for different housing resources during the slotting and prioritization process. We'll touch a little bit more in the webinar about how that kind of looks when filtering the by nameless assessment, because the vulnerability index and a couple other things are rearranged to get the highest vulnerable participants regardless of their time homeless, even though that is considered during the slotting and prioritization process. So the assessment is completed and tracked in HMIS, and that is then pulled into the by name list report that we'll get into and show you later on in the webinar. So if you're a non-HMIS participating provider, we have the hard copy on our website that we put in the chat at the beginning of the webinar that will need to be completed on the hard copy version and then again sent over to CE, which Nikki, Margaret, and Danette, and then they will get that into HMIS. Now, I know during the different meetings and leading up to this point, we've talked about how the VI index is not really working for some subpopulations and certain participants. So I'm just going to note there are discussions that are ongoing about changing up the VI tool to compensate some of that feedback that we're receiving. So once that's been approved and decided, any changes will be reflected in HMIS regarding the vulnerability index assessment. So that's something that will probably be coming down the pike. So just giving that aware here. And now we'll move on to show you what that looks like in HMIS, where you need to go to complete those. The assessment tab under the participant profile is going to be a very familiar thing by the end of the webinar.
Thanks, Amanda. So, yep. So again, we're going to go back to that profile, or we're going to go back into somebody's record, and at the top, hit assessments. The Cuyahoga Vulnerability Index is here. Again, see things like this down here, we would not like to see as the system administrators, but we only want one, right? So if there's more than one, the other one will get overridden. And then we won't be able to see maybe what an accurate score is. So you want to make sure there's only one and it gets updated until somebody becomes reactivated for whatever reason. But we'll go ahead and start a new one just to show you. Again, this cascades, so it's looking at what was already there, if somebody has already had one completed, and it pulls that information over. I'm not going to go through this one at a time. People should be pretty familiar with this tool. We've been using it for years and years and years. Um, but as you click each of these on, it's basically a point. And so behind the scenes, the assessment processor will generate a score based on how many of these that you have turned on. And that helps us to determine their vulnerability index score. And as Amanda absolutely correctly pointed out, this is going to change. This is a good tool for what it was used for in the past. I think we were coming across some very specific situations that it's not working for, specifically families. I think that was one big thing we saw is that families are not scoring high at all, which is maybe a good thing, but it's not really capturing the true vulnerabilities of families. And so we want to make sure we have tools that do identify what we can to make correct decisions based on who's more vulnerable than another. So as you turn these on, whatever you do, you'll go ahead and save it. You can add other information in here that you feel like is necessary. We will see it, right? We'll be able to see what that information is. Again, do not turn this private because we won't be able to. Uh, that will get pulled on to the by name list. Again, we will show you where that is later. All right. Moving into the slotting process. Okay, so this is I think a lot of the meat of what we wanted to talk about. Aside from sort of the HMIS based, how do we do things? This is the slotting process as it exists right now. I think it's been going very well. We've gotten a lot of people slotted that have historically probably been skipped over or that we didn't know about, or we just didn't have enough information on. And I think this is and this is sort of beginning to end how it works. Okay. So the first step in the process is we have to know what's available, what housing resources are available. And so what happens is every Monday, housing providers send an email to coordinated intake and OHS, and they identify what's available, what vouchers are available, what move-in ready units there are. And this applies not only to PSH, but rapid rehousing as well. So some of the information that we look for are maybe the building name, if that is applicable, anything. If any of this is just if it's applicable, right? We're looking for a building name, maybe an address, what a unit number, excuse me, a bedroom count. If there's a subsidy source associated, we want to know that. Anything that's ADA accessibility, any ADA accessibility information, eligibility criteria or project specific design and partners. So we're thinking about things like service providers there. If there's a certain, housing case management service agency that's identified for that specific voucher, we need to know that so we can link them with that agency. So we get that email every Monday. And from there, coordinated entry, we'll look at what's available, and then we sort the list based on the prioritization criteria we outline here. So I put right here at the top vulnerability index score, right? That's sort of the go-to um, uh, prioritization tool that we're using. And then we look at the next five categories, okay? So chronically homeless, so they meet the chronically homeless definition, they're verified chronic on the list. Then we look at long-term homeless and people who are disabled. Then we look at long-term homeless and people who are not disabled. Then we look at short-term homeless and people who are disabled, and then short-term homeless and not disabled. So basically what that means is we look at chronically homeless people first, and then length of time of homeless and disability status from there. Throughout this entire prioritization process, participant choice comes first. So we've asked, a lot of the providers are already hearing this from us, but we've asked if you have people that have very specific buildings that they want to be put in, or if they have sides of town they want to live on, that should be entered into the by name list assessment so that when we get to that person, excuse me, and let's say we have a Winton unit available, but they don't have Winton listed in their preferences, then we won't slot them for that, right? We'll slot them for what they would like. So it's going to get that's going to come first for us and management needs. So things like, okay, we have a shelter that's bursting at the seams. There's too many people. We have construction going on. We have this going on. There might be a spot where we get in where that system management need comes first. And we need to get women out of the women's shelter. We need to get the families out of Zelma George, right? Whatever it might be. We just need to do something that helps us manage the system a little better. That might take priority as well. Those things will be identified up front for you. Hopefully, nobody will be blindsided by those decisions. But we left the door open for that because sometimes it does happen, right? We have stuff that we need to move around. We have folks that need to be moved around so that we can get open up spots for other people who need them. Okay.
I'll just kind of take over where Nick left off. But yeah, this is a new process that we are um, waiting for approval of the advisory board, the next advisory board. But so during a calendar month, between 1 and up to 10% of all available PSH slots will be designated for transfers from rapid rehousing to PSH. Again, this is a new policy that we're implementing to accommodate for this need that we're seeing for rapid rehousing transfers. So we're requiring at least 6 months of rapid rehousing enrollment to be considered. Oh, okay, that's good. um, and that's prioritized based on the score of the rapid rehousing to PSH transfer housing stability assessment, which again will be coming once we get the approval from the advisory board. Chronic homelessness does need to be documented where necessary for this process to move forward. So this is the housing stability assessment that was touched in the last slide. Again, this is pending based on OHS advisory board approval in March, but this is the tool that we have determined for the transfers. Basically, it's a point where you can get certain points based on the categories here. Homeless histories, a participant has an HMIS record of previous shelter stays or outreach contracts, they will get a score of 6. For lease violation, participant has been asked to vacate unit by landlord or property manager, they will get up to 2 points. In the category of age, if the participant is 28 or younger, they will get 1 point. If the participant is between 29 and 54 years of age, they will get no points. And if a participant is 55 or older, they will also get a point, kind of highlighting the more vulnerable age groups there. Under the financial category, the participants the monthly gross income is less than 50% of the fair market rate for a 1-bedroom unit, which is about $500 in 2025. The participant will get a point of 1. Now, the next category of linkages, so we have if the participant is not connected with any resources that they may need to sustain their housing, such as employment, substance abuse treatment, mental health treatment, that participant will get 1 point for that. If it is a family or social supports not available or unable to assist with ongoing future crises, that will also result in 1 point. And then the housing plan, if a participant has not demonstrated engagement or their progress is measurable towards the housing stability plan, they will get a 1 point. And then again, that is tallied up as a total score of similar to how the vulnerability index score is, and that is going to be then pulled into this process for people to be prioritized for this transfer.
Thanks, Amanda. Can everybody, am I still freezing up or can you hear me? Am I better?
I think you're better than before, but we'll see.
Okay. I just want to note that this is based on research. This was not, something that we came up with. Housing Innovations looked into this for us and based this totally on research of people who tend to come back or recidivate into homelessness. And so this tool is meant to sort of help us guide those decisions for transfers. Um, it should be noted too that one of the things that we discussed and is going to probably be in the documentation is that the score here, if somebody's tied with somebody, their vulnerability index score will be sort of the tiebreaker. And because we're hoping that most people have a vulnerability index going into this transfer process, so we'll use that. They would need to currently be enrolled in rapid rehousing. That's correct. Oh, sorry. Yeah. Okay. So, I'm gonna keep talking. Please let me know if it gets worse. Um, so when we look at the slotting process, then how does it actually work? Well, the by name list that we have is going to be sorted based on there's three headers that we sort on. The first is verified chronic. Okay. So we'll look at people who are verified chronic at the top. Then we'll sort it by VI score, and then we'll look at total length of time homeless. So that's the unsheltered time that's in the homeless verification form plus HMIS bed days, and that'll give us our total. All right. So then each available rapid rehousing or PSH voucher will have a primary person slotted and a backup slotted. The selected participants' case managers will be notified by the end of day on Tuesday, maybe early Wednesday, and you'll be able to that's when you would sort of start the process of working on what's going to come next, and we'll talk about that in a minute. But over here on the right hand side of this slide is just a sort of a basic graphic of what we're talking about and how we determine who's the primary and who's the backup. So if we have the HMIS by name list and it has 6 names on it, Joe, Mary, Dan, Jim, Sue, Jen, right? Unit one, assuming that a unit 1 and 2 and 3 here are all everybody's preferences, right? Um, Joe, Mary, and Dan will be primary for the 3 available units, and then Jim, Sue, and Jen will be the backups, and because of the way that the by name list was sorted. Okay. So here, this is available on the guidance document that we have put out and circulated, but it's just sort of a graphic of the process from beginning to end. So over here, let's start on the left. The housing providers send that information to CE or CI. Um, CI will slot a primary and a backup, and they'll notify the case managers working with those slotted participants. Um, from there, we're going to get into the next steps in the next few slides here, but the case manager will go to that person who was slotted, offer them that housing opportunity. They'll complete the housing offer form and upload it into Clarity. They'll complete the housing offer assessment in Clarity. And then we look at, okay, does somebody accept it or does somebody reject it? If somebody rejects it, we end up moving to a backup, and then they'll have to come here back to this section of offering that housing to the backup and completing hopefully the accepted route, which is once somebody accepts, we move on to the housing application. And this whole process from Monday when we are notified of the housing resources to housing application completion, we give 2 weeks or about 10 business days. Okay, so you're notified on a Tuesday, the application is due the following Friday. And that's measured on the PSH meetings, which we'll talk a little bit about too. Um, Once that housing application is completed, coordinated entry will review it and it'll go sort of kick back and forth until everything looks good. And then CI will notify the housing provider that the housing application is available in HMIS to pull out. So there's a lot of other stuff that's going to happen in HMIS at that point. But, and we're going to get into that in a minute. But I wanted to show you real quick sort of how this works. So the by name list itself um, comes from Clarity, right? And there's within the data analysis section, you all can run that, and we'll talk about that again in a little bit. But once you run it, what we do, or what coordinated entry does, is they download it into an Excel spreadsheet so that's a little bit cleaner to sort. And you can see here we have our three fake clients. This is all the information that comes from their profile screen and the by name list assessment. There's the VI score section, okay, and all the other information that's collected along the way. And so what we do is we take it and we sort it. And the first thing we sort on is verified chronicity, then vulnerability score, which is largest to smallest, and then total number of days homeless, largest to smallest. And so it'll sort then the list based on who's verified chronic and then who has the highest vulnerability. And then the tiebreaker for that would be days homeless. And so if there were 3 units available and all three of these people qualified, all right, then it would go in this order. Happy Halloween would get first dibs, Merry Christmas, then Labor Day. Okay. So that's how we sort of implement the prioritization that we talked about in that second slide of this section. Everybody still hearing me okay? All right, good. All right, so let's start talking about the housing offer forms and the housing offer assessments. Amanda?
All right. So as Nick stated, about a little bit more of the process of what that looks like, and then sort of off after that process, what all needs to be done in and out of HMIS. One of those things is the housing offer forms and the housing offer assessments. So once the participant case managers have been notified of the primary slotting, case managers or the providing agency is then supposed to locate the participant and offer the opportunity, which then is documented via these two ways. The housing offer form is a hard copy that is located on our website, link in the chat, that will need to be signed by the participant and the worker, filled out and signed by the case manager or the participant, whether they've accepted the offer or denied it. That will then need to be uploaded into HMIS under the files tab that Nick has showed briefly in the prior slides. Then the housing offer assessment is all done in HMIS. That again is located under the assessments tab under the participants record in HMIS. And usually that is started by CE during the slotting process. We'll again touch on, what kind of roles that looks like later down in the webinar, but for non-HMIS participating providers, that's where you need to complete the offer form and send that in email to CE. And then the housing offer assessment is completed or started by CE in HMIS. We can move on to the next slide. So what does it look like if a participant accepted or denied an offer? If they had accepted the offer, then the case managers or the providing agency will move on to getting the housing application and the required documents together that is needed for that process. If the participant denied the offer, Again, that's documented on the housing offer form as well as the housing offer assessment in HMIS. But again, there's some things that kind of happen after that. If the participant has denied 3 consecutive offers, they will then be dropped down to the bottom of the prioritization list, regardless of their VI, their chronic status, due to the reason of just simply denying 3 times in a row. Again, if this happens, the participant will still maintain their status on the list as long as they maintain their homeless status, but they will not be eligible for another opportunity for 6 months. So again, this kind of highlights the importance of documenting these offers, so that we can make sure to keep the process going seamlessly when slotting participants.
If I could real quick, Amanda,
Mhm.
just want to note that when we say denying an offer, I put the word viable in here very deliberately. If we're offering them something that doesn't fit a preference, or and we just didn't know about it or whatever, if it's something that's not a viable housing opportunity for that person, we won't count that against them. We're talking about things that fit their preferences and they've denied them 3 times, and they could be different, right? Let's say they denied 3 different PSH units, even though they all fit preferences. That's when we would drop them to the bottom of the prioritization list. We don't want to ding people for preferring to live somewhere, right? Like that's not what we're going for here. What we're going for is we've offered you things that we think fit your preference. You've told us that they fit your preference, and you've just outright denied them. That's when these sort of the 6 months of ineligibility for PSH or housing opportunities would come into play. So I just want to make sure that's noted pretty clearly. Thank you.
Thanks, Nick. I also want to note, I think perfect timing, that there are some exceptions to that, that if a housing provider is rejecting an offer for whatever reason, that will also not count as a ding towards the participant. Or also if there's been a missed application deadline where the documents couldn't be gathered and uploaded in the appropriate time frame that Nick has highlighted, that will also not be dinged against the participant. And I'll go into more about how to note that of the reasons for the denial as we move through the responsible parties of what or who needs to do what. So for if a primary has been selected for a certain housing resources, what's the start of that look like? So that's going to start with coordinated intake going into HMIS to start that housing offer assessment. What they're adding is what type of housing has been offered and if there's been a building associated with that offer. That's all that CE is going to be going in to enter it. Because then once the process goes through the 2 weeks, case management is notified, then the baton kind of gets passed off to them in a way. So case management will then go into the participant's HMIS record. They're going to go into the assessments tab. They're going to go in and look at the already housing offer assessment that's been completed. And they're going to go in and enter the date that they offered the housing to their participants. Now, that's not going to be the date that they were slotted. That's going to be the date that you're actually going to your participant and offering them that housing resource. They're also going to note then at that time the offer outcome and the date. So that could also be different from the time that they were offered the housing resource. If you offer them one day, they want to think about it a couple weeks, or I'm sorry, a couple days, that will be then reflected in HMIS accordingly. Case management is also then responsible for noting if the documents are ready from the housing offer, as well as the application has been submitted, as well as the date that that was submitted. Then, once all that's been completed, the baton essentially passes over to the housing providers, and they will go into that same housing offer assessment to add the following. The application, if that's been submitted, and the date that it's been submitted, if there's been an interview completed, and the date of that interview, if it's not been completed, as well as the housing inspection, if that's been completed, or if there's a date for that. So that's all under the responsibility of the housing providers. Now, with that being said, there's notes that can be entered by anyone at any time for any reason that will kind of help the collaboration effort of going in, making sure that all the pieces have been essentially taken care of. So now what does that look like for a backup that has moved into the primary slot? So again, this is only if the primary has denied the offer, and now we're moving on to the backup that was slotted. Coordinated intake essentially doesn't need to do anything with the housing offer assessment in HMIS. That becomes the starting piece for the case management or the housing provider, excuse me, the case management providers to go in and start. So they will go in under the assessments tab to create a new housing offer assessment. When they go in, they're going to be adding the date the housing offer was, or excuse me, the date the housing offer was given to the participant, the type of housing offered, if there was a building associated with that resource, the outcome and the date that that offer happened, if the participant is document ready, and if the application has been submitted. Now, again, this doesn't have to be completed all at once. You could go in similar to the by nameless assessment and enter the information that you have completed that time to kind of keep yourself like a running checklist to help you keep on track. So once the case management goes in to complete that, then the baton moves over to the housing providers to, again, and enter in the following: if the application has been submitted, if there's been an interview that's been completed, if not, if there's a date for the interview, as well as the housing inspection. Again, the notes section is a great piece to help with the collaborative effort of keeping track of where we are, what we're waiting on. If you have like a time frame of when documents are going to be ready or uploaded, those things are what we're looking for in the notes of the housing offer assessment. So we'll go into, again, the assessments tab in Clarity to show you how to get that started.
Thanks, Amanda. So again, assessments tab, housing offer assessment. You want to complete one housing offer per housing offered. So if they've been offered a PSH unit, maybe they've also been offered a HUD-VAST unit or whatever it might be, you can complete one for each thing that's been offered and track the status of that offer in a different assessment. So all these things that Amanda was talking about, so coordinated entry will create this housing offer assessment initially for primary slotted individuals or families. They would put only the type of housing offered, and if it's a building, what building it would be that was offered. Okay. Um, but that's it. That's all coordinated entry is responsible for, because they don't know when you're going to offer that housing to them, which is sort of the case manager's responsibility to enter. They don't know what the offer outcome is until you all tell them. So we're hoping that you're going to put that here. So you can put accepted or denied, client rejected. We also added in a new option, denied, because the application deadline was missed. Again, we didn't want to hold that against the person, so we created a new denied outcome. Then case managers are also responsible for putting in a document ready for housing offer. Just are the documents gathered that we need for this housing offer, yes or no? Okay. You can also put the date that you submitted the application as the case manager who completed it, and the date, so that you say that you did submit it, and then the date you submitted it. We also, if you probably noticed that housing providers also have a responsibility to fill this in, because if they get it and they know it, then they can also put that in. So you'll put that in the date, then offer interview completed, yes or no. If it was completed, what was the date? And then housing inspection completed, yes. When was the inspection date? Okay. Then there's the offer note section. The other date that plays in here is the date that they move in, of course, and that comes from the enrollment screen for most of our projects or programs that we're referring to. And so what we're really trying to get at with this housing offer assessment, is the length of time it's taking someone to get from point A to point B, right? Point A being homelessness, point B being housed, right? So the point of offer to the point of being housed, and sort of what is taking the longest, where are the gaps? And so without having all this information filled in, it's not useful. right? And I'll tell you that right now, this is the biggest, I think, gap that we have. We have all these dates in here for a reason, but not a lot of them are getting filled out. And it's because the people who are doing a lot of the work in the by name list right now are not the housing providers. It's coordinated entry for the most part, and it's some case managers do it a lot, right? But they don't always know when the offer or the interview was completed or when the inspection was completed, and so that's kind of stuff that we need housing providers to get in and do more of as we move through this. Oh, keep going to the wrong one. Sorry, guys. All right. So let's talk a little bit about the applications then. Now, this is not going to be a training on how to do a PSH application, and we're running short on time, so I'm going to try to zoom through this as fast as possible. But basically, once you are notified, you do then do the housing offer and the housing offer assessment. And so then after they accept, you move into the PSH application. And this is just sort of the review process, right? Not how to do the application itself, but the case manager will complete the application and gather the correct documents. The case manager then will upload a completed application into the file section of the HMIS record. Then they'll be notifying CE via email that it's been uploaded, and then CE will review it, and there's going to be a back and forth with the case managers, getting fixes applied, things that need to be edited, updated, whatever. And then coordinated entry, just like a sidestep, if somebody's uh, referred or slotted for a CMHA unit of any kind, CE will complete a CMHA preference letter that does add some extra steps for people, like case managers. You'll need to do the pre-app, you have to do the full PSH app along with the full CMHA app. So that process is a little bit lengthier. But CE is ultimately responsible for doing those preference letters to get them verified for CMHA. And then CE will notify the housing provider via email that the application is there for them, and they will go in, and then the housing provider can go in and grab that. If you're a non-HMIS provider, you will send the applications directly to CE via email, and they can review that way and get it over to the housing provider. Okay. One thing I want to make sure I note is the deadlines or not, the timelines associated with PSH applications. The PSH application must be dated um, within 120 days of approval. So you need to date your applications when they're uploaded. If they're not dated, they'll get kicked back to you. Upload them dated, and as long as it's within 120 days, it'll be good. Homeless letters, disability verification, Social Security award letters, etc. Things that really are more static, right? Things that sort of stay long term. They're not changing as often. That has to be within 120 days of approval as well. But things like pay stubs, food stamp letters, statements of no income, or any other fluctuating income document of any kind, that has to be dated within 30 days of approval. So those are things that might need to be updated if you've turned in an application, let's say, today, but it takes a while for Eden to get it or approving it, whatever. We might need you to update those types of documents. But that's a significantly shorter list than what used to be. So I think the barriers to that process have been at least minimized for a lot of case managers. All right, so just real quick, because I don't think we can overstate how to do this. But in the file section of the client record, you add the file, okay? Choose the correct category. In this case, is housing documentation. And then we have our PSH application. And you would select it from your list of files and you would add the record. There's obviously other things that might be needed, um, like birth certificates or IDs or proof of income. So we have options for a lot of that stuff. So you'll just go in and choose the right one and upload those. Sometimes it's okay to put things together, but most of the time those side documents like IDs and things like that should be uploaded separate application. Great. Okay, just a quick note about this. Um, Many of you have been involved in the conversations about this, but we are moving towards a universal supportive housing application. So right now we have a lot of different applications out there that exist for different subsidies, scattered site application versus a PS or a building application, a CMHA application versus a COC application. And so in quarter 2, we're hoping that we're going to get the universal application for all the subsidies to be completed in HMIS on one application. Um, Supporting docs will still need to be uploaded into the files, but the process of completing one HMIS app, I'm sorry, PSH application in a the next steps, so the ones what we're working on right now is creating reporting to have it come out of the system in an application format and not as raw data. So if you've worked in HMIS before and you've pulled data, you know that it really pulls out as like charts, right? Most of the time, unless we've applied some sort of dashboard, functionality to something. And so what we were working with them very soon on is taking the USHAP, which we've already created in HMIS, and getting it to come out in a very readable application format as opposed to raw data. And so real quick, under assessments, once again, I have here, we've already created the universal supportive housing application. And a little sneak peek for you. I'm not going to go through the whole thing for the sake of time, but this is it. This is what we've come up with. It's already built out. It looks lengthy, as most applications are. And but I do think it's significantly easier because like I said, everything is all in one place. You don't have to go find a new application for a new subsidy source or anything like that. So that's that. More to come on that soon, but that's the direction we are moving. All right, we're going to talk about inactivation now and when to inactivate, and we're running low on time, so we'll move through as fast as we can. All right.
Yeah, thank you, Nick. So just for the sake of time, I know we want to get to the Q&A section of the webinar, but ultimately when you have a participant that has been housed or have been missing for 90 days, that is when we need to be inactivating participants in the by name list. So whether, like I said, they've been permanently housed or non-permanently housed, it's the responsibility of the HMIS participating housing providers to go in and inactivate that person on the list. Again, that's on the profile screen that was highlighted at the beginning of the webinar. It is CI's responsibility to do that for non-HMIS participating housing providers. Now, if they've been missing, if the participant has been missing, we will highlight that in the housing meetings on Friday. That at the 60-day mark to let you guys know, hey, these participants are coming up to 30 days of the inactivation time frame. So we'll give notes and things during those meetings, but at the 90 days, we'll review that in the meetings, is then the HMIS participating housing provider's responsibility to go in on the 90th day. It could be later, it could be after the 90th day, but when you enter in the status change date on the by name list in the profile screen, you use the 90th day, not the day that was the current date or the date that you were notified, but it's the 90th day that that participant has been missing.
Oh, sorry, I was
Again,
okay. Go ahead.
that's okay. To inactivate them, that's on the profile screen in HMIS. I don't know if you want to go to,
Yeah, we'll make it real quick. So
yeah.
again, we mentioned this before, but there's 3 inactive choices. So you'll go ahead and choose whichever one pertains. And then when you do that, the list choice will go away, and then you'll just change that status date. So when did you change it? Again, that should be backdated to the 90th day. So if it's 10 days after the 90 days, you want to go back to whenever 90 days was. But that's pretty simple, and that's how we get them off. This is everybody's responsibility. We are looking to housing providers to do it if they have been permanently housed. We're looking for case managers to do it if they have been in the shelter or were in the shelter and then have been gone for 90 days. And then we will do some of that as sort of like functioning as coordinated entry. We will do some of that in Friday meetings as well if we notice that somebody's hit that mark. So again, collaborative effort here. But it doesn't work if only one entity is taking on the work of a lot of other ones. So we got to make sure that we're all doing it. Let's talk a little bit about reactivation. Amanda, go ahead.
So yeah, we talked about when to inactivate, but when do we know to reactivate? I know we've touched it's earlier on the webinar. It's based on homeless period of homelessness. So if a participant who was inactivated because they've been missing, but ultimately reengages and seeks COC housing resources, that is when we will go in the profile and again start the process over. You can choose what list to go on, what date they are going on, and the status. Again, if they were housed but ultimately ends up losing their housing and returns to homelessness, that's a new episode of homelessness. So that is when we would need reactivation on the by name list. Again, we have listed here the subpopulations that should be listed, excuse me, should be activated upon uh, on the by name list are those subpopulations, regardless of housing plans again. And what does that look like in clarity? Just going back into the profile screen, selecting the different list that your participant will want to go on, whether they're active and sheltered, the status, the by name list, and the status change date. You just need to go in and re-enter all those.
Yep. And at that point, we would do a new by name list assessment and a new vulnerability index to account for this new episode of homelessness. All right, let's talk about the meeting schedule. So every Friday we're having meetings at 1 o'clock with whoever wants to be invited. We really are what we're doing in those meetings is we're reviewing and updating housing plans. So people who hit that 60-day mark, we're going to be asking about them to see, you have 30 days left before they become inactive. What's their plan? What's the plan to get them out of shelter? Um, and we'll add those updates onto our spreadsheet, but it is something that you all need to be doing in HMIS to restart the clock. So you'll want to make sure that you're doing that. We give updates on slotted, or we don't give updates. We ask for updates about people who have been slotted and what the process or the application process and the status in that process is. We review the time frames and the deadlines around, who's coming up due, who's needs what, right? Um, and we will decide in that meeting sometimes to move on to a backup if we know that somebody's application will not be done by the end of that day.
Um,
Um,
Sorry to interject here, but there was a question in the Q&As to just highlight, if we can, who actually needs to be at these meetings.
mhm. So housing providers should definitely be there. I think that it's helpful to have housing providers available for questions about the applications or interviews or things that are in process in that sort of housing process, right? Um, and then we want people who have the case managers who are working on these applications. We want you there as well because we need to hear from you where you're at in that process. And then really anybody who's got somebody on the chronic list that wants to advocate for somebody or has people who have been on the list for a while who haven't got an opportunity, those people should come and advocate as well. Um, it's hard for me to be like, yeah, everybody should come because I know that that might be a waste of some people's time. But if you know you have people on the chronic list that you're working with and you want to provide updates on them to the group or ask about resources or um, do any of that, right? That sort of takes place as well. This idea of case conferencing around people. Okay, they've denied housing. What can I do with them? Is there any other opportunities that we know of, right? That are non-COC funded? Um, like that kind of stuff will happen too. So there's the Friday meetings, and then I should also mention that THRH from the YHDP project, also that slotting takes place on the Tuesday, ending youth homelessness case conferencing meetings. That's at 12:30 to 1:30. And so if you're a youth provider or a youth or young adult provider, you want to be in those meetings because we would be slotting for that resource there. That's just a little more complicated, so we've decided to do it within that meeting. Okay. So it's every Friday, 1 to 2 for these meetings, and then every Tuesday, 12:30 to 1:30 for the youth and young adults. Okay. All right. By name list report in HMIS. So real quick, There's a difference in access role for who gets to pool, who can pool, and who sees what on the list. So if you have an agency administrator system-wide data analysis or an outreach manager slash agency admin system data analysis access role, you're going to be able to run the report and see the entirety of it. Okay. You're going to see everybody's data, um, regardless of if you were the one who did it or not. But those who have just the basic agency administrator or outreach manager, agency administrator access role, you can run the report, but you're only going to be able to see their agency's data, like your agency's data. All participating agencies are responsible for knowing which agency users have access to run the report. So please do not email me and Amanda and go, hey, who can run the report for my agency? Please talk to somebody within your agency. That's something that we cannot make a determination on. I mean, yeah, we give the access roles, but that doesn't mean that we are going to determine who can pull that for you. That's got to be something you decide at your agency. Um, those users should run that report regularly and distribute it to people who need it, and then get updates and add those into HMIS. So if you don't have direct access yourself, you should be working with people who do, and get those updates in. So um, it's not great for you all to give us updates because in these Friday meetings and not put them in HMIS because that the restarting clock issue. Okay. It's also not great to ask us for additional licenses if your only goal is to put in some notes here and there. Um, we don't we have a very limited number of licenses that we don't charge anybody for. Um, and the more we have to get, that might go away, right? And so we don't want to make this something that agencies have to pay for. We want you to sort of streamline your workflows the best that you can. All right. So I'm just going to real quick show you where to find this report. Here's the directions to it. But if you go into your reports section of HMIS, at the top, if you have the right access role, you'll have data analysis here. And it is a built-in, I'm sorry, a Cuyahoga Clarity System report down here under BNL, Cuyahoga by name list. Okay, so you would click run and it would generate this. It would look similar to this. This one is just our fake clients right now, but it'll obviously have the entirety of the list there, depending on which list you choose, along with the housing offers. And so you can see each housing offer, and this shows you the last three. So I see we're over time, but we did hit the question and answer section. So if you have a question you'd like to ask, please let us know and we can unmute you. So just raise your hand. Should have a raise your hand function at the top. I'll start by answering any questions that are in the Q&A that we didn't get to.
One is, I don't know if you want to touch on the Disability Plus during the prioritization process. That was one question that came up.
Yeah. So Dedicated Plus, HUD has not offered us any way to track Dedicated Plus and HMIS, even though a lot of the grants have gone that way. We have talked about adding that to the I can't remember if it's the VI or the transfer document, but that's as close as we've gotten to documenting that. We have so many chronically homeless folks that we usually just stick with that, of course, because those are obviously the ones that need it the most. And then we usually do fall into that dedicated plus territory, and it takes CI a little bit of time to sort of determine if somebody falls into that definition, but um, that's how we're handling it right now. Terry, let me unmute you. All right, Terry, go ahead. Oh, oh, I've allowed your mic.
Terry, oh, there we go.
Okay, there we go. Hey, how you doing? Hey, what do we do in the situation? We have guys coming through and they refuse to sign a ROI. How would we proceed forward
Yep.
with that?
So the HMIS ROI.
That's correct.
Yeah. So if they're not already created in HMIS, you would follow that consent used process that we talked about earlier. So when you are creating somebody new in HMIS, you would choose consent refused and then add in any of those demographic questions. And then we can still activate them on the list. So that's where you would have to track the unique identifier and uh, track who that person is outside of our system so that if they do come up, we have them. We know who they are. If
Right.
somebody is already created, oh, go ahead.
I was gonna say thank you. That's all. Thank
Oh, is
you.
that good? Okay. If somebody's already created though, like, and they have, so Happy Halloween's already, I just want to make sure that they have one that's active down here, and they do, right? They have a few that are active, and so I'm covered because they've signed or given verbal consent at some other agency.
Thanks.
All right. Yep. Nikki, allow your mic. Go ahead and unmute. Nikki. Okay. We'll come back to you, Nikki. You should be able to unmute. Um,
I'm not sure. She did have a question in
Oh,
does
wait.
the
Oh, am
oh,
I
there we
oh,
on?
there
go.
you are.
Yep.
We
Okay.
hear you.
Sorry. So I know just going back to the HMIS refusal, I know you mentioned that
Mhm.
that's at 1%. We're
Yeah.
noticing an increase in individuals who don't feel comfortable signing the release. And we're actually, Lydia, I think is tracking that information. I guess my question is where did the 1% come from?
Yeah, so that's across a lot of COCs that allow anonymous records. 1% is sort of the limit, and it's not to say that you can have more than that, but we're going to flag it because the idea is that you should be continuing to work with them and eventually have them sign a consent if that's possible. But that is a standard across many COCs in Ohio.
Okay, because I mean, I think that having the information and seeing and especially with the political climate, we're noticing
Hmm.
an increase in individuals not consenting. So I don't, I wouldn't think that there would be any kind of anyone would be penalized for anything of that nature. I just wanted to kind of put that out there because I know that some people had expressed concern about that.
Yeah, so I don't want to say there's a penalty. I think if we get to a point where it's like a really high percentage and we're gonna start asking questions about why that is. But
Yeah, we're
the
tracking it. I mean,
yeah.
it's really enlightening to see why people are refusing.
Mhm.
Um, but okay.
Yeah,
Thank you.
yeah, we're not no penalty other than like I said, just asking questions about it. I do think too it's really to deter people from doing that every single time, right? That shouldn't be the case. We shouldn't see the majority of your people refusing. Um, I think we need to explain HMIS a little bit better if that's the case.
Okay, thank you.
Hmm.
I think this is kind of perfect to go into Ebony's question in the Q&A regarding the 6 months to be deprioritized for denying housing offers 3 consecutive times. Ebony just is wanting to know if additional consideration been given to adjusting the time frame, what evidence supports enforcing 6 months versus 30 days or another time frame, and what measures will be taken to investigate the denial.
Okay, so the 6 month time frame. So I want you to consider the fact that if you are slotted 3 different times and you end up denying those 3 offers, you essentially set us back 6 weeks in getting certain housing opportunities or housing units, whatever, filled. That causes issues on sort of the administrative end, but also from a grants perspective, we can't have units sort of sitting out there for that long. And it so it delays our process. So the measure is once we know why somebody denied, that's why we have somebody fill out the housing offer form. There is a reason for denial on there. The person has to sign it. So we are assuming that that has been offered to them, and then we'll know why because it has it on our form. So we've adjusted all of our documentation for that. It should be noted that's why we do both. That's why we do the housing offer form and the housing offer assessment, because the form really tells us, okay, they actually offered this to that person. That person is accepting or denying it with a signature. So we know that they saw it or heard about it. And then the housing offer assessment helps us track time frames. The evidence is again, if you go, I want you to go look at any other COC and look at their process with the by name list. A lot of folks actually, if you deny 3 times, don't get considered at all. And so we felt that that was a little unfair, and of course our COC can't really allow for that. There's gonna be a lot of people who would sit in shelter for a really long time, right? But yeah, that's really what it comes down to. Think about this too, that the person who's denying it is already chronically homeless and they have now denied 3 housing opportunities. So adding 6, it's they're going to be homeless, right? And they're choosing that. So um that's where we're at with it. We have not considered adjusting it at this point. No one's hit that point yet. So we can see what the ramifications are long term once we do start seeing it more.
And then the only other one that I'm seeing that we have not touched in the Q&A is from Nikki. Does the lease violation pertain to the rapid rehousing housing or past housing history?
Nikki, I'm gonna enable your mic again. Where are you referring to there? At what point in the
That's for
process?
the transition from rapid rehousing to PSH,
Ah,
that point system.
yep.
This is all currently, right? This is all those that point. I know you're going to go right there. You just had it.
hmm
This is in regards to their current experience in rapid rehousing, or is this in regards to prior history?
This is, I believe it's their current housing.
Okay.
Are they being asked to vacate, or did they violate a lease for some reason? Is that what is leading to their homelessness?
Okay, so that would be like the current snapshot of what they might be experiencing enrolled in rapid rehousing. Okay.
Yes. Yep.
Okay. I also did have another question about how can we like safeguard the verified chronic
Yeah.
feature? Because I noticed that there are providers going in and verifying people chronic. Obviously, and that is a CE role. So I don't know if there's ability to do that or if you could speak more on that.
Yeah, so because it's a shared assessment, that we can't make certain questions, available only to certain entities. Um, the only way to do that would be actually to add it to a different assessment that only CI can access. And at that point, we would be, I think, creating a little bit of a, I don't want to call it a barrier. It would be challenging for reporting because we're going to be pulling it from a different assessment at that point. But I think that what we need, Nikki, you and I we should work more together on this and figure out, who's doing what, and how many times people are doing it. And then we can talk to those people. And again, this is serving as a training, so everyone should be hearing me that that's not allowable, right? That you all should not be verifying chronicity. That is a CI function. So let's keep an eye on it closer. But I think for now that's all we can do.
Okay, well, those are all the questions that I was able to find in the Q&A. I'm not sure if anybody else has any other questions.
Not seeing any other hands up. Okay. Well, thank you for bearing with us. I know this went over a little bit longer than we anticipated, but we've had good questions. I think a lot of people are invested in this, which is really helpful. If you have any questions about anything, please reach out to us. We're going to get this recording set up along with a slide deck. And again, you can always reference our website for all the other guidance, but all this stuff will be there as well. If you have any hiccups in the process, right? We want to hear about those in real time. Please let us know because we can try to make adjustments if we are noticing issues that are pretty consistent across a lot of providers. So thanks again. You all have been great, and we will talk to you soon.
Thanks, everyone. Have a good rest of your week.